I am Dr. Aris Mosley. I am the medical director and psychiatrist of the Valleywise First Episode Center. What brought me to healthcare? I honestly don't know. I just know that probably around the age of 5, I told my mother that I wanted to be a baby doctor. And I think in my mind at that time, that meant a pediatrician. Yeah, I've always wanted to be a physician. There's nothing else I've ever wanted to be. So I'm not quite sure what inspired me to become a physician or want to become a physician. Perhaps it was God. I was born and raised in Phoenix, Arizona. I was raised in Central Phoenix, maybe around like the 7th Avenue and Indian School area. I had a really great childhood. I had parents and family that really loved me and supported me and guided me and knew as African American individuals that life is not always easy for us, and it definitely is not always fair. And so my parents made sure that I had the best in terms of my education, so I would better be prepared to navigate the outside world. I know for myself, I was very nervous when I went into labor because I knew going in that the mortality rate for Black mothers was high, and I was nervous. Even as a physician, I was nervous. And so unfortunately, I did experience that during my delivery. And so I think that my hope is pretty basic, just that everyone receives the care that they deserve, because we're all human beings. And when you have to go in for assistance with your health, you're at your most vulnerable. And the last thing that you want to have to deal with is the care that you receive based on the color of your skin. I'm extremely proud to work for Valleywise Health. It is where I did my psychiatric training when I was in medical school. It is where I did my residency. It is where I did my child and adolescent psychiatry fellowship. So for me, it feels like home. There's something to be said about staying where you're at, staying where you're trained, because you know the community. So for that, I am very proud. My future hope for Black children is to feel safe and to be able to go out into the world and live and be happy. I mean, that's pretty basic. In terms of Black children going into healthcare, yes, please. We definitely need more people of color, not just Black people. We need people of all races, origins, ethnicities, whatever word you want to use. We need more of that, because there is absolutely something to be said about being able to see yourself in the person that's treating you. It's kind of mind-blowing sometimes. I'm like, how did I get here? But it's an honor and a privilege. And if I'm being completely honest, it's a calling. As I said earlier, there's nothing else that I ever wanted to do, and I don't know why. I don't have an answer, but being able to represent my people and show that we are more than a talking point or a clip on TikTok or I don't know, whatever it is that people think about us as Black people, to show, unfortunately, that we're smart and we're educated and we can do great things and that we're just like everyone else. It's a blessing. I am a human being and a mother and a daughter and a sister, and I'm a physician.